everyone, I am Anurupa, going to be second year MBBS student from MG Medical College, Jamshedpur. This video will be about clavicle, the side determination of the clavicle, the features of the clavicle and the attachments of the clavicle. The attachments including the origin, insertion of the muscles and the attachments of the ligaments. So let us start with the side determination of the clavicle. A clavicle has two ends, medial end and lateral end. The medial end is large and is quadrangular, whereas the lateral end is flattened. The clavicle shaft is divided into two parts, the medial 2/3 and the lateral 1/3. The medial 2/3 is convex forward and the lateral 1/3 is concave forward. The superior surface has no groove, but on the inferior surface groove is present called as the subclavian groove and an oval impression is present. So this will be a right-sided clavicle. If this is a right-side clavicle, then hold always the clavicle on the right side in its anatomical position and explain with the other hand. Let us see the features of the clavicle. The clavicle has two ends, medial end and lateral end. Medial end is also known as the sternal end because on the medial side sternum is present and the medial head of the clavicle articulates with the manubrium of the sternum to form the sternoclavicular joint. The lateral end of the clavicle is also known as the acromion end because on the lateral side scapula is present. The lateral end of the clavicle articulates with the acromion process of the scapula, forming acromioclavicular joint. The shaft of the clavicle is divided into two parts, the medial 2/3 and the lateral 1/3. The lateral 1/3 of the shaft of the clavicle has two borders and two surfaces, the anterior border, posterior border, superior surface and inferior surface. The anterior border is concave forward and the posterior border is convex backward. The superior surface is subcutaneous and the inferior surface has a conoid tubercle and trapezoid ridge. Now let us see the medial 2/3 of the shaft of the clavicle. The medial 2/3 of the shaft of the clavicle is rounded and has four surfaces, the anterior surface, posterior surface, superior surface and inferior surface. The anterior surface is convex forward, the posterior surface is smooth and is concave backward, the superior surface is rough and the inferior surface has an oval impression in its medial part and a groove known as the subclavian groove. In the lateral 1/3 of the clavicle, the anterior border give origin to the deltoid muscle, the posterior border give insertion to the trapezius muscle, and on the inferior surface, conoid tubercle and trapezoid ridge is present. These both give attachment to the coracoclavicular ligament. Coracoclavicular ligament has two parts, the conoid part and the trapezoid part, and both the parts are attached into the inferior surface of the clavicle. In the medial 2/3 of the shaft, the anterior surface give origin to the pectoralis major. The superior surface give origin to the sternocleidomastoid muscle. The posterior surface give origin to the sternohyoid muscle. And in the inferior surface of the medial 2/3 of the clavicle, there is a subclavian groove which gives insertion to the subclavius muscle and the margin of the groove gives attachment to the clavipectoral fascia. This oval impression on the inferior surface gives attachment to the costoclavicular ligament. So this is all about the side determination, the features of the clavicle and attachments of all the muscles on the clavicle.